In emergencies, every second counts. The actions you take in those critical moments can mean the difference between life and death. Knowing what to do and what not to do can make all the difference. Proper first aid knowledge empowers you to act swiftly and effectively. Unfortunately, there are many first aid myths circulating that can do more harm than good. These myths can lead to dangerous mistakes in emergency situations. This essay will debunk common first aid myths and equip you with accurate information to keep yourself and your loved ones safe. By understanding the facts, you can avoid common pitfalls and ensure you're providing the best care possible. Knowing the right course of action is crucial in emergencies. For example, performing CPR correctly can double or even triple a person's chance of survival after cardiac arrest. Incorrect first aid can worsen injuries and lead to complications. Missteps like using ice on a burn or tilting the head back during a nosebleed can cause more harm than good. Let's separate fact from fiction and make sure you have the correct knowledge to provide safe and effective first aid. We'll cover the most common myths and explain why they are incorrect, providing you with the right techniques instead. Remember, while this essay provides general guidance, it's always best to consult with healthcare professionals for specific medical advice. They can offer personalized recommendations based on the latest medical research and your individual needs. Stay informed and be prepared to take action when it matters most. Equip yourself with the right knowledge and tools, and you'll be ready to make a positive difference in any emergency situation. One of the most enduring first aid myths is applying butter to a burn. This seems to make sense, as butter is cool and soothing. However, applying butter to a burn is counterproductive and potentially dangerous. Butter traps heat, which can worsen the burn and increase tissue damage. Additionally, butter is not sterile and can introduce bacteria into the wound, increasing the risk of infection. The correct approach is to cool the burn immediately with cool, not cold, running water for 15 to 20 minutes. This helps to reduce heat and minimize pain and swelling. After cooling, cover the burn loosely with a sterile bandage and seek medical attention if necessary. Blisters are the body's natural way of protecting a wound. They form a barrier over damaged skin, preventing infection. While it may be tempting to pop blisters, it's crucial to avoid doing so. Popping blisters disrupts this protective barrier, exposing the wound to bacteria and increasing the risk of infection. It can also slow down the healing process and potentially lead to scarring. Instead of popping blisters, keep the area clean and dry. Cover the blister with a loose bandage to protect it from friction and irritation. If the blister breaks on its own, gently clean the area with soap and water, apply an antibiotic ointment and cover it with a sterile bandage. Section 4, Myth 3, rubbing alcohol on fever. Another persistent myth is that rubbing alcohol on the skin can help reduce fever. While alcohol evaporates quickly and can create a cooling sensation, it's essential to understand that this method is not only ineffective but also potentially dangerous. Rubbing alcohol on the skin can be absorbed into the bloodstream, particularly in children, leading to alcohol poisoning. This can cause serious health complications, including seizures and coma. The best way to manage a fever is to focus on keeping the person comfortable. Encourage them to rest, drink plenty of fluids, and dress lightly. Over-the-counter fever reducers such as acetaminophen or ibuprofen can also help lower body temperature. Section 5, Myth 4, lifting fainted people. In this section, we will debunk a common misconception about how to handle someone who has fainted. When someone faints, it's a natural reaction to try to revive them by lifting them up. Many people believe that getting them upright quickly will help them regain consciousness faster. However, this is not the correct course of action and can actually be detrimental. Lifting a fainted person can cause more harm than good. Lifting a fainted person can worsen their condition by restricting blood flow to the brain. When someone faints, their body is trying to get more blood to the brain, and lifting them up can counteract this process. It's essential to allow them to lie flat on their back to improve circulation and ensure adequate blood flow to the brain. This position helps the blood flow more easily to the brain, aiding in a quicker recovery. If someone faints, gently lay them down on their back and elevate their legs slightly. Elevating the legs helps increase blood flow to the brain, which is crucial for their recovery. Loosen any tight clothing and ensure they have plenty of fresh air. Tight clothing can restrict circulation, and fresh air can help them regain consciousness more comfortably. Once they regain consciousness, help them sit up slowly and offer them water. Sitting up too quickly can cause them to faint again, so it's important to do this gradually. If fainting persists or they experience other symptoms, seek medical attention immediately. Persistent fainting or additional symptoms could indicate a more serious underlying condition that requires professional medical evaluation. Section 6. Myth 5. Removing objects from the eye. Getting something stuck in your eye can be a painful and uncomfortable experience. It can happen in an instant, whether it's a speck of dust, an eyelash, or even a small insect. The immediate reaction is often one of panic and discomfort. While it's natural to want to remove the object immediately, it's important to approach this situation with caution. Acting hastily can lead to more harm than good. The eye is a delicate organ, and improper handling can exacerbate the problem. Attempting to remove a foreign object from the eye yourself can cause further damage, especially if it's embedded in the cornea. The cornea is the transparent front part of the eye that covers the iris and pupil, and it's very sensitive. Rubbing the eye can also worsen the situation by potentially scratching the cornea. This can lead to infections or even more serious eye conditions. It's crucial to resist the urge to rub your eye, no matter how uncomfortable it feels. If you have something in your eye, try blinking rapidly to allow tears to wash it out. Tears are the eye's natural defense mechanism, helping to flush out foreign particles. Blinking can stimulate tear production and may dislodge the object. If this doesn't work, flush the eye gently with clean water or saline solution. Saline solution is preferable because it matches the natural salinity of your tears, reducing irritation. Tilt your head to the side and pour the solution from the inner corner to the outer corner of the eye. If the object remains or you experience vision problems, seek medical attention from an eye specialist. Persistent discomfort, redness, or blurred vision are signs that you need professional help. They have the necessary tools and expertise to remove the object safely without causing further damage. Eye specialists can use magnification and specialized instruments to carefully extract the foreign body, ensuring your eye remains healthy and unharmed. Section 7. Conclusion: stay informed, stay safe. Knowing the truth about common first aid myths is crucial for providing safe and effective care in emergencies. By debunking these myths and arming yourself with accurate information, you can make a real difference in a critical situation. Remember, when it comes to first aid, always err on the side of caution. If you're unsure about what to do, seek professional medical help. Your quick thinking and knowledge of proper first aid techniques can help prevent further injury and potentially save lives. Stay informed, stay prepared, and stay safe.